So the Vannier system he designed was a series of remedies that would stop the person who had a very suppressed system from aggravating. Okay? Now, so normally when you give a constitutional remedy to someone who is, even if they're a little bit sick, you'll get a slight aggravation. Now Hahnemann said that that aggravation, in terms of the potency, the aim being that it was meant to be gentle. Homeopathy was gentle. So the aim being that the aggravation that you want is a gentle aggravation, and then the vital force kicks in, and the constitutional, you see the constitutional remedy working. Now, Vannier's system is based on, if the person is really sick and it's very suppressed, you give them the constitutional. He said that the aggravation would always be extreme. Okay, now you take, okay, so we move from Vannier in 1950 to now. Now I'm seeing women who are, the average being aged 38 to 46, trying to get pregnant. Okay, now the problem is that they have been on the oral contraceptive pill, often 18 years, 15 years being the average, right? They've been on a drug that has suppressed ovulation. And it's not just a little suppression, it's quite extreme. So all of this time, this has been shut down. Then they come off the oral contraceptive pill, and it's been medically accepted that it can take 6 months to a year before they will start ovulating again. Okay? So this woman walks in, after 3 months, she's highly anxious, she's wanting to get pregnant. You give her a constitutional remedy, and it's going to aggravate so intensely that her follicle stimulating hormone is going to go too high. Why do I know this? Because I've done it 5 times and it's gone up high 5 times, and I've never treated constitutionally since. If her follicle stimulating hormone goes too high for a woman in that age group, you can run the risk of shutting down the last chance that you've got of getting her ovulating and getting her pregnant. Okay? So women, like when you get older and you're moving into a perimenopausal state, your follicle stimulating hormone starts to go higher and higher and higher. If it goes too high on a blood test, you can see this woman's going into perimenopausal. Therefore, she won't kick in ovulation, she won't ovulate, she won't release the follicle, she won't get pregnant. Logical. Alright? So Vannier said, if you do a drainage remedy, and then you do a lesional remedy, and then introduce the constitutional, and then introduce the miasmic, you will gently move her through all of the physical disabilities. So that the drainage remedy was the functional remedy. It was what you could see was functionally not working. It was what you would see as the sensations, as if that part that was not working. That was what he said was the drainage remedy. Then the lesional remedy was the structural problem that was actually not working. And then the constitutional is pretty much what we would see was the constitutional in what we're used to using as the constitutional. So it's the totality of everything. So you would see all of the picture, all of the characteristics, the physical, mental, emotional, all within that constitutional. And then the miasmic remedy would match the degree of suppression. So I started taking the Vannier system and used it and had really good success. Women were getting pregnant easily, weren't aggravating, and I was combining a whole series of remedies together. So the Vannier system is based on 4 remedies working as one whole picture. They all have to be compatible and they all have to work together. So what I started then doing was taking the remedies that, after a while I did a survey of all the remedies that I was using and started to work out that the majority of the time I was using borax as a drainage remedy, because it matched the mucus not working very well. It was where the estrogen was very suppressed, the mucus wasn't very good, right? And there was very low sexual energy. That was the drainage remedy that I was using in the majority of the time. So I did this for about a year. Then I sat down and went, okay, come on. What am I doing here? I keep using the same remedies. So then the main remedy that I was using on the lesional for the functionality in terms of what was actually wrong with the structure was sepia. Now, logically, you would often think of using sepia. They've got repeated miscarriages. They've got all the things that you would normally associate with sepia. The menses are really irregular, very, suppressed, yeah? The bearing down sensation, the bleeding too heavily, not bleeding heavily enough, the cysts, etc. That you would normally associate with the structural of sepia. That's what I was using continually. So I went, wow, okay, I've got a real pattern here. Then I started to notice that the majority of the time, as the constitutional, I was using natrum muriaticum. So then I looked at all the rubrics for natrum. And they were where the cycle was irregular. They had all the mental emotions of what you would normally associate with natrum, which is the fear of letting go, the fear that they're not going to get pregnant, the fear of the grief associated with that, everything that you would normally see in a natrum muriaticum picture is what I was seeing. And then when I took the natrum and looked at all the physicals of natrum, it went across the board in terms of the cycle, the irregularity of the cycle, etc. Then I looked at the miasmic remedies, and the majority of the time I was using thuya for where there was very suppressed menses, where the woman wasn't bleeding very often, where she had high levels of thrush, very acidic, very thin watery mucus, where it was quite suppressed. And that was the miasmic remedy that I was using the most for that picture. Then I looked at medarhinum, and I was using medarhinum exactly for what you would normally use medarhinum for if you were using it as a miasmic, for where the periods were really heavy, clotted, history of cysts, history of sexually transmitted diseases, very, thin, watery mucus again, but very sort of fishy smell, exactly what you would normally see with medarhinum. Okay? So, I then developed what is and has to be acknowledged as a very systematic system of using the homeopathic remedies. So it's very different to constitutional prescribing. This is a system that I've worked out. But this system is dealing with a suppressed organism. Very different to what you would do with constitutional. I'm not the type of person that has sat down and said, okay, I trained as a constitutional prescriber, so therefore I can only do that. I've said there have been an enormous amount of homeopaths that have worked. Each in history have come up with a different approach. I have to take from each of those homeopaths what they have contributed, including Vannier. And Vannier came up with this system that is absolutely perfect for now. And that's how I came up with using the Vannier system. Then I've changed it, adjusted it, increased it, added an extra miasmic remedy, etc. Occasionally, I'll use a Vannier system if someone has got extreme acne, right? And I've done that once or twice to stop the acne from aggravating if I give them the constitutional. So often I'll do a drainage and a lesional and a miasmic, and then they're constitutional. But I'll use a traditional Vannier system. But I've really done it 3 times in my practice. with extreme acne, and it works fantastically for exactly the same reason. And all of those 3 patients have all had a history of using Roaccutane. Same picture, incredibly suppressive drug. They stop using the Roaccutane and the acne returns to exactly the same picture. That's the only other time that I've ever used it. All the rest of the time is constitutional. But you can't go past the fact that you can't, if the woman is not ovulating, it's suppression, okay? If she hasn't got any mucus, right, even if you get her ovulating and the mucus is no good, right, how is the sperm going to get there? The vagina is really acidic. There's no mucus. You have to change what you're doing with her. And so I started to adjust the homeopathics accordingly. So I started using Borax 30, and if somebody comes in and they've got no mucus at the time that they're ovulating, even if they are ovulating, then Borax is definitely the remedy for the mucus. Then if she comes back for a follow-up and the mucus, everything else is working really well, but the mucus is still very watery and thin and not really, thick and very mucousy, then I'll increase the Borax to a 200 potency. Right? And I'll do that along with all of the other remedies. Sometimes I'll actually give the Borax 30, sometimes I'll add the Borax in from day 5 to day 14 to increase the mucus just before she ovulates, or I'll drop the Borax 30 and just use the 200. All of those changes I teach in the program according to, when I do the PowerPoint, I have a series of cases that I present where I didn't do it according to da. So it's not just, this is what you do with every patient. You've got to learn what all the remedies do, what the Borax does, what the sepia does, what Natrum muriaticum does, and you've got to be able to work out all the miasmic remedies accordingly.